So hello everyone, let's discuss a very important topic, respiratory failure. Respiratory failure. It's a simple topic, respiratory failure. Now respiratory failure, see this is one important cause of ICU admission in any tertiary care setting. Okay, and it is very important to aggressively treat this entity, otherwise it can land up in mortality. Okay, so regarding respiratory failure, we are going to subdivide respiratory failure into four types. You have type 1 respiratory failure, type 2, type 3 and type 4. Four types of respiratory failure. Now what is the basis of such a classification into four types? Why don't you just put it as a single failure? It is because that these different types of respiratory failure, they have different pathophysiologic mechanisms. So it is based on the pathophysiology that you divide the respiratory failure into four types. Clear? Okay. Now what we are going to do is, we are going to learn the individual subtypes of respiratory failure. The most important ones are the type 1 as well as type 2. Because these are the ones in which you often get questions for your exam. But however, you have got to know what is a type 3 failure as well as a type 4 failure. Alright. So first we will discuss type 1 respiratory failure. Type 1 respiratory failure. So type 1 respiratory failure, you can call it by another name. This is a oxygenation failure. Okay. This is a oxygenation failure. Okay. Now what do I mean by an oxygenation failure? See, you have the alveoli here. Okay, you have the alveoli and you also have the capillary here. Okay. And so you know that the diffusion of gases is taking place across the alveolo-capillary membrane. What happens in type 1 respiratory failure is that there is a oxygenation problem. Okay, that is, for the capillaries to receive this oxygen, you have got to receive it from the alveoli. But what happens in type 1 respiratory failure is that there occurs something that is known as alveolar flooding. Okay, so your capillary is dependent on your alveoli for oxygen. But what happens is that when the alveoli is flooded with something, it may be fluid, it may be blood. Okay, so when it is flooded with something, do you think a normal gas exchange would happen? It is difficult. So the normal diffusion, so there is an impairment of the normal diffusion across the alveolo-capillary membrane. That is what happens in your type 1 respiratory failure. So this is why I say that this is an oxygenation failure. Okay, oxygenation failure. And what happens is that when there is an oxygenation failure, you tell me what will happen to your PaO2, that is the partial pressure of arterial oxygen. See, the alveolar oxygen is there here, PaO2, and the arterial oxygen is your P small a O2. Okay. So the arterial oxygen will be decreased because it is not receiving it from the alveoli. So there will be a decreased value of PaO2. Okay. That is very, very important. So you can say that there is a hypoxemia. Okay. There is a hypoxemia. Okay. And this type 1 respiratory failure is also referred to as a hypoxic respiratory failure. Okay, hypoxic respiratory failure. And you can add one more point here, that what will be the, you tell me what will be the A gradient. Okay, what is this A gradient? That is your alveolar arterial oxygen gradient. What do you say? What will be the gradient? See, the alveolar oxygen is actually normal. The only thing is that the alveolar oxygen is not able to reach the capillaries through the alveolo-capillary membrane. So because of which this gradient would be what? Increased. This is another important point that you have got to know. Okay, very clear. Okay. because all these might be options in your question when the question is asked for your exam. And then what happens is that you understood the alveolar arterial oxygen gradient will be increased. Now you tell me what will happen to the partial pressure of carbon dioxide, PaCO2. See, what happens is that normally the carbon dioxide would be given out from the capillaries to the alveoli. But yes, there is a hyperventilation happening here, okay, because the patient is having a hypoxia, and because the hyperventilation is happening here, there is no problem for the carbon dioxide, letting out the carbon dioxide, okay. So the carbon dioxide would actually go through the alveolo-capillary membrane, and because of which there is a carbon dioxide washout sometimes. So the PaCO2 will either be normal or it will be decreased. Okay, this is another important point. So though there is a hypoxia, your arterial carbon dioxide will be either normal or because of the washout it will be decreased. Okay, very clear, because the carbon dioxide has a higher diffusion power across the alveolo-capillary membrane compared to your carbon dioxide. So it can actually diffuse no problem. So that point is also clear. Okay, now having understood what basically is a type 1 respiratory failure or the oxygenation failure, let us see what are the conditions that can produce type 1 respiratory failure. Okay, I told you the basic problem is a alveolar flooding, correct? No, alveolar flooding. So what are the conditions that can produce alveolar flooding? One is pneumonia. Okay, so you have some exudates in your alveoli. Okay, so there is a pneumonia can have a type 1 respiratory failure. ARDS, acute respiratory distress syndrome, or non-cardiogenic pulmonary edema, that can also produce a type 1 respiratory failure. Then you can have even your congestive cardiac failure where there is a cardiogenic pulmonary edema. So there also you will have this alveolar flooding. So there also you can get type 1 respiratory failure. So these are all acute conditions producing type 1 respiratory failure. Remember, type 1 respiratory failure can also occur in conditions like chronic conditions like a interstitial lung disease. Okay, interstitial lung disease. So always keep these points in your mind. Okay, type 1 respiratory failure. Now again a couple of conditions also you have got to know. See, suppose a patient is having a pulmonary embolism. Okay, a patient is having a pulmonary embolism. See, what is that is going to happen in pulmonary embolism? There is a blood clot in maybe one of the vessels in the lungs. So because there is a clot that is obstructing the blood flow, what will happen is that the perfusion across the alveolo-capillary membrane is not going to happen, at a good rate, correct? No, so that will be impaired. However, yes, the oxygen is reaching the alveoli, but it is not able to reach the capillary side just because there is no blood there. So in effect, there is no effective oxygenation that is happening. So even pulmonary embolism also can present with a type 1 respiratory failure. So you know that what happens in pulmonary embolism is nothing but a dead space ventilation, correct? No, a dead space ventilation. Now why do I say that this is a dead space ventilation? Because the air is coming to the alveoli. Okay, there is no problem with the alveoli, air is coming. But again in the capillary wall there is some clot here. So there is no flow of blood there. So only if blood is there the proper exchange would happen. So that is not happening and you have a dead space ventilation. So the PaO2 will again be decreased in case of your pulmonary embolism. Okay, so keep that also in mind. But later I will be discussing certain points like pulmonary embolism can also go into a type 2 respiratory failure. I will discuss that later, but for the time being, remember pulmonary embolism can produce type 1 respiratory failure. So the next condition I want to discuss with you is an acute asthma. So acute asthma also can produce a type 1 respiratory failure. Okay, so these are the important conditions that you should know that can produce a type 1 respiratory failure. What are the key points? it is an oxygenation failure, that is number one, the most important one. The alveolar flooding, decreased value of PaO2, AA gradient is increased, PaCO2 normal or decreased, the conditions producing them, very important, okay, very clear. Now we will move on to the second type of respiratory failure. What is it going to be? Your type 2 respiratory failure. Type 2 respiratory failure. You remember I told you type 1 respiratory failure was an oxygenation failure. Okay. Now this type is referred to as a ventilation failure. Okay. This is a ventilation failure. Okay. So the problem is with the ventilation. Okay. And some people also say that this is a pump failure. Okay. Pump failure. You can also call it the pump failure. Okay. So ventilation failure or pump failure. So what happens here is the primary problem is not a oxygenation failure. The primary problem is with the ventilation. So when I say that it is a ventilatory problem, see, it could be a problem with the pump. So when I say pump, it includes your skeletal apparatus, that is your rib cage. It includes your neuromuscular apparatus, that is your nerves, the neuromuscular junction, the muscles supplying your respiratory wall, okay, neuromuscular apparatus. And not just that, it includes even the central nervous system, because you have your respiratory center, okay. So the respiratory center is there in your brain. So the respiratory center is also, when the respiratory center is also affected, that also can produce a ventilation failure. So any condition that is reducing, okay, your ventilation and producing hypoventilation. So all these conditions can result in hypoventilation. Okay, hypoventilation. So I'll just first say a few examples of conditions that can result in your type 2 respiratory failure, and then we'll go into what are the gas exchange abnormalities. Okay, so that things are simple for you. So regarding the conditions, see, it could be, I told you, a skeletal problem. So it could be a kyphoscoliosis. Okay, it could be a kyphoscoliosis. It could be another condition where there is a limited chest expansion, like ankylosing spondylitis. Ankylosing spondylitis, where we have discussed already in the rheumatology module on ankylosing spondylitis. So then even obesity itself, which can cause hypoventilation, okay, so that itself can cause. You can have neuromuscular junction problems like myasthenia gravis. You can have conditions like your motor neuron disease, conditions like botulism, okay, botulism. So all these conditions, and maybe some poisoning also when you have affection of your respiratory center. So all these conditions, and what is common between all these conditions, all of them will result in hypoventilation. Hypoventilation. Clear? Okay, it's very simple, okay. So I hope everyone is with me. This is a very simple topic. See, in respiratory system, problems happen only when you try to complicate it. When you understand it as it is, you know, it is very easy. But you know, it is only when you create problems for yourself that, you know, learning becomes tough in respiratory. So this is very, very simple. So these are the conditions that can produce. Now, what are the gas exchange abnormalities that can happen? Definitely here also you will get a decreased PaO2. Okay, no doubt about it. Because, you know, your ventilatory, there is a hypoventilation, which means you are not giving anything out, you are not taking much in as well. So this is a decreased PaO2. So definitely there is hypoxia, but there is a difference. Remember, in type 1 respiratory failure, okay, type 1 respiratory failure, you had hypoxia, but this hypoxia was without hypercarbia. Correct? You agree with me or not? It was without hypercarbia because carbon dioxide was normal or reduced. But here what happens is that though there is decreased PaO2, arterial like PaO2, but what happens is that your PaCO2 will be increased. So PaCO2 will be increased. So why is the PaCO2 increase? I told you the basic problem is hypoventilation. So ventilation is not happening properly. You are not exhaling enough carbon dioxide also through the alveolo-capillary membrane. So that effort is not there. And because that effort is not there, what will happen? You will have a carbon dioxide retention. So it is the carbon dioxide retention that results in a increased PaCO2. So what will you call it? You will call it a condition where there is a hypoxia with hypercarbia. Okay, hypoxia with hypercarbia. Very simple. Okay, hypoxia with hypercarbia. And also know another point, that in case of type 1, you had an increased AA gradient, correct? Alveolar arterial oxygen tension gradient was increased. But what about in case of type 2 respiratory failure? See, type 2 respiratory failure is not because of any oxygenation problem. So it is that the problem is not that you have oxygen available at the alveoli, it is not reaching the capillary. That is not the problem here. So the AA gradient, okay, the AA gradient in case of your type 2 respiratory failure will be normal. Okay, this is again very, very important. Okay, so AA grade. So these are the important points that you have got to keep in mind with respect to your type 2 respiratory failure. Now just one more point I would like to add. In fact, 2 points. See, in addition to the conditions that you learned in this list where there is hypoventilation, even an acute severe asthma, okay, acute severe asthma, which was previously called your status asthmaticus, even such a condition can produce type 2 respiratory failure. See, you remember I told you it can produce type 1, the acute asthma. But what happens is that when it is a status asthmaticus, you know that it almost goes to the stage of a silent chest, where the ventilation is also not happening properly. So at that particular stage, you can have a type 2 respiratory failure. Okay, that is very important. And also when you have a foreign body, okay, a foreign body obstructing your air passage, in such a scenario also the ventilation would be affected and you can have a type 2 respiratory failure. Okay, so you also keep in mind that though you have these entities, type 1 respiratory failure, type 2 respiratory failure, certain conditions can progress from type 1 to type 2. So it is not that a pneumonia will just produce a type 1 respiratory failure alone, or a ARDS would produce a type 1 respiratory failure alone. It's not like that. See, at presentation an ARDS may be a type 1 respiratory failure. But see, at that time there was hyperventilation. But what happens is that after some time there may be a fatigue of your respiratory muscles. So when there is a fatigue of your respiratory muscles, then what happens is that the ventilation is not happening. So at that time the type 1 respiratory failure can get converted to a type 2. But for your MCQs, you know, it is better that you learn, okay, type 1 respiratory failure, ARDS. But remember in your mind, this can go to type 2 respiratory failure as well. It is not a watertight compartment, you know, that is this many causes for type 1, this many causes for type 2. You can have a type 1 proceeding to your type 2 respiratory failure as well. So you understood the conditions producing type 2 respiratory failure. I hope it is very clear, simple, no? Type 2 respiratory failure. So after having understood type 2 respiratory failure, we move on to the type 3 respiratory failure. Type 3 respiratory failure. So type 3 and type 4, you just have got to know what it is. Okay, type 3 respiratory failure. So this is a type of respiratory failure that occurs usually in the, sometimes in the surgical settings and all, where you will have a atelectasis, maybe a post procedure. There was some major surgery, and a post-surgical procedure, you might have some atelectasis. Okay, some post-surgical atelectasis. So when there is a atelectasis that is happening, what happens is that all your alveoli are actually collapsed. Correct, no? So the alveoli become collapsed, there is a atelectasis happening there, and because of which the patient may develop respiratory failure. That is what you call a type 3 respiratory failure. So always keep this in mind, atelectasis is associated with your type 3 respiratory failure. Very clear? Okay. Now we move on to the last type, that is your type 4 respiratory failure. Type 4 respiratory failure. So type 4 respiratory failure is a type of respiratory failure that occurs in patients who are having hypoperfusion of respiratory muscles. Hypoperfusion of the respiratory muscles. So naturally, when there is a hypoperfusion of the respiratory muscles, they won't be able to work properly. Correct, no? So this hypoperfusion of respiratory muscles occurs in what setting? You tell me, in what setting does the hypoperfusion occur? It occurs in the setting of a shock. Okay, and this shock can be a cardiogenic shock, and it can very well be a hypovolemic shock. Cardiogenic or hypovolemic shock, either of this. Okay, so when you have a hypoperfusion, it can result in affection of your respiratory muscles, and subsequently you can have type 4 respiratory failure. Clear? Okay, so these are the types of respiratory failure, type 1, 2, 3, 4. Type 1 and 2, very important. Okay, 3 and 4 also you might get a clinical scenario based questions. So remember, type 1 is an oxygenation failure. Type 2 is a ventilation failure. Especially it occurs in conditions where you have maybe your diaphragm and other respiratory muscles which are paralyzed. Maybe as a result of a Guillain-Barré syndrome also. I think I forgot to mention the entity of GBS. Okay, yeah. Just add that also, a Guillain-Barré syndrome also. So, Guillain-Barré syndrome, or maybe some condition that can produce a diaphragmatic weakness. Okay, so patient will be having respiratory problems also. So, this is what actually results in a type 2 respiratory failure. Okay, so I hope this topic is very simple for you now.